My name is Ruhl. I am a Senior Medical Officer working here at Kobe House in Toowoomba. We're a multidisciplinary sexual health clinic with a lot of other services under this one roof. There are a lot of surprises sometimes about training in rural areas. The diversity of practice and some of the very long-running relationships you can end up having with some of your patients is a real value add to the job. Some of the opportunities in regional areas are different, both better and worse in some instances. I think the holistic care, the multiple opportunities to get hands-on experience. Even in intern years working in a regional area, you are more than a glorified administrator with a very powerful signature. You still have a lot of clinical practice opportunities that you might not get in a larger metropolitan centre where you're one of many. So things that influenced my decision to train rurally, not a mentor or anything particularly, but a lot of very good, very highly trained, multi-skilled doctors in rural areas that are really patient-centred and willing to go the extra mile for a patient and make things happen, as opposed to consistently referring on and making it somebody else's problem. If you're thinking about training towards rural generalism, it is a little bit more in-depth and extensive than ordinary GP training. There are two colleges that offer the extended training pathway to rural generalism, both the College of General Practitioners and the Australian College of Rural and Remote Medicine. It certainly opens up a lot of doors in terms of the additional flexibility, the additional skills you can offer your patients in the future, whether that's mental health like myself, or obstetrics, anaesthetics, surgery, Indigenous health, lots of opportunities for academic medicine as well in the extended skills training pathways. I love that we can really help quite a diverse and underserved community here, particularly lesbian, gay, bisexual, trans and intersex people, and the refugee community to help their entry into Australia. Some things that really excite me about the journey I've had in rural medicine and rural generalism is how varied it is and can be. I've started, with my advanced skill training in mental health, and at the moment I'm working in a sexual health clinic. But the Australian College of Rural and Remote Medicine that I'm a fellow of really enables me to work in a variety of situations across this country and others. So I think that's the big draw for me. If you're considering working in a regional or rural area, I think you do need to weigh it up personally. It does take a particular type of personality to succeed, but I think trying it is, particularly going through med school or some of your junior training, it can open up a lot of doors to you both professionally, socially and in terms of your training. Some things that make this job different are because I'm drawing on a much broader background, I suppose, than an equivalent job in a larger metropolitan centre. I can add a lot more to it, I think, than some other services. So the breadth of practice here is a lot broader than your average sexual health clinic. I've really enjoyed my rural training and where I've gone so far.